I'd now like to welcome Michael TILDESLEY to the programme. He's an expert in infectious disease control and Associate Professor at the University of Warwick. Thank you so much for being with us, Professor. First thing is first, is there too much panic and not necessarily enough accurate information? What should we as individuals, me, myself here, what should we be doing to avoid contracting COVID-19?
Well, I mean, I would still emphasise a lot of the standard advice that's coming out relates to good hygiene practices. So despite the fact that the epidemic seems to be progressing in multiple countries, it's really important not to forget the key messages to reduce your own risk of infection, which is regular hand washing, of course. If you know that you may have been in contact with infected individuals, consider sort of self-isolation measures. If you yourself are experiencing cough or cold symptoms, then always try to cough into a handkerchief, wash your hands and so forth. And, you know, these sorts of measures are still really important on an individual level when we know that the virus is still circulating.
Now, can you tell us what the main differences are between coronavirus and the seasonal flu?
Well, a lot of the symptoms that we're seeing will, of course, be very similar to what we'll see with seasonal flu. The big difference that's coming out is potentially the more severe symptoms, which we may be seeing in slightly larger numbers. Now, this is a little bit complicated because a lot of the headline reports of mortality rates, which we're seeing maybe sort of 2 to 3%, depending upon the country, are based upon the fact that we are assuming that the only people that become infected are those that actually experience severe symptoms and are diagnosed with infection. What we don't know still is how many individuals are in the population and may be infected but have very mild symptoms, or maybe even asymptomatic and have no symptoms at all. If those numbers are quite large, then actually the reported mortality rates could be very much overestimated, and actually many more people may be infected, but we're just not detecting it.
We're not detecting it at this stage. There are some contradictory reports out there. There have been some cases of severe forms of the disease in healthy people. Can you talk us through that?
I'm sorry, could you repeat the question? I didn't
Yes,
get
I was
that
just saying we're hearing rather contradictory reports out there because there are some cases of severe forms of the disease in healthy people.
There are, and I think this is extremely complicated because of any particular individual, when they get infected, will behave in a slightly different way. And this can be due to a number of reasons. This can be due to, yes, underlying health conditions, but also how much of the virus they get exposed to. And so you may see some healthy people will literally just have a cough and cold and recover. Some may experience more severe respiratory symptoms. And that's why it's really important as an individual, if you are experiencing these symptoms, the advice is still self-isolate and basically contact a doctor to seek advice regarding the next steps. Because, of course, it's really important that if you are experiencing more severe symptoms, then you seek appropriate healthcare.
You're talking a lot about self-isolation. Do the infected not need to be hospitalized? Because that seems to be the case in Italy. Out of, I think it's 12,000 infected, 5,000 are currently being treated in hospital.
Well, and again, this is really important that that is judged on an individual basis. So those that actually are experiencing really severe symptoms do need to be hospitalised to seek treatment. But for the vast majority of us who may be infected, it will be very similar actually to seasonal flu in terms of how severe it will be. So you'll have a cough or cold, and actually the advice then is to self-isolate within your own home. What we want to avoid here is really large unsustainable demands on the health service. That's why it's important that, yes, those that do have severe symptoms get the necessary health care. Those of us that may have milder symptoms proceed through self-isolation at home.
Is it too early to say how far we are from a vaccination at this stage?
Well, I mean, in general terms, actually, the development of a vaccination can take many months, if not years. I mean, this research is ongoing, but there are several steps that need to go through before we have a vaccination that is actually able to be used actively within the community. As I say, that research is ongoing, but it's unclear now as to whether that may take months or even, we may not be seeing a vaccine available until next year or beyond. Therefore, what we need to do is really, really push forward with these kinds of containment and isolation measures so that we can reduce the impact of the infection now, with a view to continuing that research so that we may be able to develop a vaccine in the near future.
And one last question for you coming in from the viewers. Using masks, is that just for people who don't want to spread the disease as opposed to those that want to avoid contracting it?
So the use of masks, and again, there's a lot of controversy over the use of masks or not. Generally, I mean, there is some evidence that if you are infected and you wear a mask, you slightly reduce your risk of transmission. There's also some evidence that, if you are uninfected, wearing a mask can reduce risk slightly. The problem with it is it's not going to eliminate risk. And there's also some research that suggests that those people that wear masks and are uninfected may take other sort of more risky practices. They may not necessarily observe other hygiene practices because they're wearing a mask. So it's always one of those things where wearing a mask can help, it can reduce your risk, but it is not a substitute for following other advice, other hygiene practices, other necessary isolation measures.
Dr. Michael TILDESLEY of the University of Warwick, thank you so much for being with us and talking us through the COVID-19 crisis.